Hello, in this tutorial we're going to continue with other microorganisms and the class of antibiotics that are going to target them. So for the other microorganisms, we have what is called parasites. Basically, so we are going to have parasites. Now, for the parasites, generally you have the parasites. The parasites that can be affecting the human being are divided into two. We have the protozoans and you have the worms. Basically, the protozoans and the worms. Now, for the protozoans, we have the protozoans like the Plasmodium species. Basically, it's Plasmodium species, which is made up of the Plasmodium falciparum, the Plasmodium ovale, the Plasmodium vivax, the Plasmodium malariae, and then the last one is the Plasmodium schrizogenum. So those are the five plasmodium, and what is most common in our context Cameroon is the Plasmodium falciparum, and it's also the most virulent. Basically, the Plasmodium ovale and the malaria are the one that are going to cause what is called a relapsing fever, meaning that somebody has malaria, is treated with malaria, and then later on, some months after, he still have malaria. Basically, that is the relapsing fever. The fever is coming after a period of time. Now, malaria, Plasmodium malaria is going to result to what is called the recrudescence fever. Basically, the recrudescent fever. Now, the etiology of the relapsing fever is that the Plasmodium ovale and the vivax are capable of causing are capable of producing hypnozoids, and the hypnozoids are the Plasmodium species that are going to be stored at the level of the liver, and the artesunate and all those anti-malarials. Artesunate does not kill the hypnozoids. That's why you're going to have relapsing fever. In the case of recrudescence fever for Plasmodium malaria is going to be high at the level of the red blood cells for a period of time, and thus the recrudescent fever is going to come after a period of 3 months when the red blood cells are going to be broken down. Basically, so it's a life cycle of the red blood cell, because since the malaria parasite in the Plasmodium malariae do not come out of the red blood cells, basically they are stored at the level of the red blood cells. The artesunate is not going to act on them, basically. So in this case, you are going to have a recrudescent fever after a period of 3 months. While the Plasmodium falciparum now is the one that is the most virulent, because it results to the rupture of all the red blood cells, and all the trophozoites are released into the bloodstream. Immediately when you are treating Plasmodium falciparum, there is nothing like relapsing fever nor recrudescent fever. Now, for Plasmodium schrizogenum, now it is more inside chimpanzees. Now, other protozoans that you have Entamoeba histolytica. Entamoeba histolytica, and just the Entamoeba species. Under the Entamoeba species, we have Entamoeba histolytica, Entamoeba parahistolytica, and we have also Entamoeba coli. Basically, now we need to know that there is a difference between Entamoeba histolytica and Entamoeba coli. Both of them are involved in the gastrointestinal tract, basically, but you need to know that among both of them, the Entamoeba histolytica basically is the one which is pathogenic. The Entamoeba histolytica is the one which is pathogenic, while the Entamoeba coli is the one which is non-pathogenic. Now, when you are doing stool analysis, there is a difference between the morphology of each of them. Generally, you need to know that the protozoans have two major elements. We have what is called the trophozoites, and we have what is called the cyst. Basically, so generally the trophozoites of the Entamoeba coli, basically the trophozoites of the Entamoeba coli is going to be having 8 nuclei. Basically, their trophozoite is going to contain 8 nuclei. Are you understanding? Why the trophozoite in the case of Entamoeba histolytica is going to contain only 4 nuclei. Is it clear? That is the first difference. The trophozoite is going to contain 4 nuclei. Now, in the case of the cyst of the entamoeba coli, the nucleus of the cyst of the entamoeba coli is going to be centric, is it clear, located at the center, while the nucleus in the case of the cyst of entamoeba histolytica is eccentric, meaning that it is not located at the center. Is it clear? So I'm going to send you an image of what I'm talking about inside the comments. Is it clear? So generally those are that. Now we have other protozoans like the Giardia. Is it clear? You have the Giardia lambia, other protozoans like Giardia lambia, other protozoans like Cryptococcus. So you are going to have Giardia lambia, which results to gastroenteritis with secretory diarrhea. You have Cryptococcus. Is it Cryptococcus? Is it the next one after Cryptococcus? You have Isospora bedi. Is it clear? Now the next one after Isospora, we are going to have also Cyclospora. Is it clear? So all of them are inside the protozoan Cyclospora. We also have Schistosomiasis. Is it clear? And we have also Leishmania. Leishmania. We have others like which causes sexually transmitted infections is going to be Trichomonas. Trichomonas vaginalis. We have other which causes sleeping sickness. And the one which causes sleeping sickness is going to be transferred by the tsetse fly, and it's called trypanosomiasis. Trypanosomiasis. Is it clear? Trypanosoma. So we are going to have Trypanosoma gabiense, which is much more located at the equatorial region. The Trypanosoma gabiense. That is for the scientific name. So those are the different microorganisms that you have also in at this level. After the Leishmania, you have also the Leptospira. All of that are located as protozoans that can result to infection here, and I'm going to speak about the general antibiotics that can target the protozoans and the specific antibiotic for the protozoans. Now later on, we're going to speak about the classification of worms. Is it clear?